Hello everybody, today we will talk about creatine kinase MB, CKMB, one of the most important cardiac markers. So in this lecture, we will cover the all aspects of the CKMB, and at the end of this lecture, we will also see the important scenario related to the CKMB. First of all, we will see creatine kinase, CK. What is CK and what are the different forms of the CK? CK, creatine kinase, present in the muscles, skeletal muscles, cardiac muscles. It's an important source of energy in the muscles. Creatine bind with the ATP. Actually, ATP transfers the phosphate group to the creatine. It will convert into the phosphocreatine, and remaining phosphate will be the diphosphate, adenosine diphosphate. So one phosphate has been transferred to the creatine, and it is an important source in the muscles. So creatine kinase is a dimeric enzyme because it has two subunits, M unit and the B unit, B for brain and M for muscles. It has three most important isoforms: CKBB, brain. CKBB is present in the brain and the lungs. CKMB is specifically related to the cardiac muscles, and the cardiac muscles releases the CKMB. And CKMM muscle, this form is present in the skeletal muscles. So our main target will be CKMB, that is related to the cardiac muscles. So, but the question is, when does this CKMB release into the blood? So, here is our heart. Whenever you see the damage to this heart, then in case of heart attack, or you can say myocardial infarction, in that case the cells of the heart, cardiac cells, start dying, and ultimately the content of the heart muscles start releasing into the bloodstream, and one component will be the creatine kinase MB, CKMB, start releasing into the blood. And after that, we can do blood test and we can check the presence of the CKMB in your blood. Now this CKMB will represent the conditions of your heart, whether the your heart has facing the problems of the heart attack, or you can say myocardial infarction. So it means that CKMB is most important cardiac markers, so through which we can detect the conditions of your heart. But it can also be released in other conditions, so we have to rule out the whether the increase of the CKMB is related to the heart or other reason. Next, we will see the time period. When does this CKMB start releasing in your bloodstream? If I say when the patient faces heart attack, or you can say myocardial infarction, it will take 3 to 6 hours in releasing of the CKMB in the blood, and the peak value will be 12 to 24 hours. It means that in 1 day it will be maximum in the blood of the patient, and it will return to the normal in 48 to 72 hours. That is important thing. But the trop I, that is an important cardiac marker, will start returning in 5 to 10 days. It will present in the blood of the patient for a long duration as compared to the CKMB. Next, if we talk about the normal values, CKMB, if we see it through the activity, because it's an enzyme, so we can check its activity. So activity less than 25 unit per liter is normal, while if we talk about its mass, less than 5 nanogram per ml is normal. But if we want to rule out whether presence of the CK-MB is related to the heart or the other reason, we can go toward the CK-MB index, in which we will calculate. We will add CK-MB at the top divided by total CK, all isoforms, multiply by 100. So we can take the percentage. If the percentage is less than 3, then it will be related to it can go towards the skeletal muscle cause. But if the percentage is greater than 5%, then it will go towards the cardiac origin. Next, we will see in what condition you will see the increase in the CK-MB. So you can see the two most important reasons, cardiac reasons and the non-cardiac reasons. In the cardiac reason, you can see the acute myocardial infarction. And in case of myocarditis and after the cardiac surgery, you can see the increased CK-MB. But non-cardiac reason is skeletal muscle injury. You can also see the CK-MB increment in that case, renal failure and the muscular dystrophy. These are the non-cardiac reasons. So we have to correlate the CK-MB with the clinical manifestations, and along with that we can also go towards the TROP-I as well. Next, we will see the scenario. A 58-year-old male presents to the emergency department with severe retrosternal chest pain radiating to the left arm for the last 5 hours. He had myocardial infarction 3 days ago. Also facing myocardial infarction 3 days ago and was discharged yesterday. But the question is, as I have told, TROP-I will remain in the blood for 5 to 10 days, but the CK-MB will remain in the blood for 48 to 72 hours. ECG, in ECG you will see the ST elevation, TROP-I is positive and CK-MB is positive. 3 days. That's why TROP-I is still present in the patient, because it has been 3 days for the patient MI. So TROP-I is present, is still present, but you can see reinfarction in that case, because 3 days, in the 3 days CK-MB start normalizing, but still CK-MB is present. It means that reinfarction has been occurred in the body of the patient, because CK-MB again start increasing in the body of the patient. So that is important, because in 2 days CK-MB start normalizing, but after the 3 days CK-MB is still present. It shows reinfarction is happening in the body of the patient, and TROP-I is already increasing. That is the cause of the previous infarction, but the increase in the CK-MB is due to the reinfarction in the body of the patient. So this is all about the CK-MB, creatine kinase MB. If you still have any question regarding this cardiac marker, you may ask in the comment section. Thank you so much.